On this episode of the Ask Mike Reinold Show, we talk about post-operative stiffness in shoulders, we talk about prophylactic ankle taping, and we talk about the difference between neural and soft tissue flexibility.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Welcome back, everybody, to the Ask Mike Reinold Show. We are here answering your awesome questions on rehab, fitness, sports performance, business, baseball,
Gymnastics.
other sports, anything you guys want to talk about, please ask away. Go to MikeReinold.com, click on the podcast link. Be sure to subscribe to us and ask us some awesome questions. There's a form on there that you guys can submit your questions. We want to hear from you because we're getting a ton of great questions. Keep them coming. We love it. So we're here at Champion PT Performance up in Boston. Lighter crew for this one here. Lenny Macrina, Dave Tilley. We're here keeping it intimate, right? We want to have like an acoustic unplugged session here. No student asking
Spotify
questions.
Big three.
We promise. So, what do you think? Soon we'll have a student soon. We promise.
2 months.
We'll have a student soon. But today,
Gymnastics student.
Lenny's turn. What does that even mean?
They're coming for gymnastics stuff, especially.
Nobody comes for gym. They're coming for physical therapy.
Olympics are over. We're done until 2020.
At least till Tokyo. Nobody cares.
Oh wait, I dated it.
All right, Lenny is going to be the question reader today. So shoot away, Len.
I'll try to read it like Gabe. No, I won't read it like the Gabe banana.
No one can read it like Gabe.
All right, Wade from Springfield, Ohio. I work for a hospital-based outpatient clinic, and I see a lot of rotator cuff repairs 3 days post-op. The majority of my patients are extremely stiff, and painful with passive range of motion, and have too much scapular elevation with shoulder flexion and abduction. Is the joint-by-joint approach the reason they are stiff? And is it actually an increase in neural drive due to the reverse in the stable, mobile continuum?
Boom. Okay. All right,
Neural drive,
I'll start this one. I'll tell you, they're stiff in their shoulder and they're compensating with scapular elevation because they just had rotator cuff surgery 3 days ago. No, I mean, in all honesty, I'd say a normal presentation of someone post-operative with rotator cuff, obviously they have a lot of pain, a lot of swelling, their cuff shuts down, it's not working well. So one of the big compensations when they try to move around or you have stiffness of the glenohumeral joint is your scapula moves more, right? So moving your arm in space is two things. It's glenohumeral and scapulothoracic joint, right? I know it's other stuff, but those are the two big ones. So if glenohumeral is limited, you're going to get more scapulothoracic. Let's not make this a bigger thing than it is. It's just that they just had rotator cuff surgery. So, calm down the tissue, the pain, the inflammation, turn the cuff back on, and that'll start to get it better. But man, I don't know. The joint-by-joint approach has significant limitations. It is not something you should swear by. It is very two-dimensional. Every joint needs mobility and stability and all that fun stuff. I would not say that has anything to do with it. It's purely just the normal consequences.
Joint by joint is like just a theoretical principle to go by for assessing people and watching them move. And I think like surgery, acute injury, fall, like completely like kind of, to me, like puts that on the back burner until you deal with the way your body responds to a massive injury. Like surgery is a massive thing. So it's like when you're talking neural drive and neural performance, it's like that thing's guarded. Just like your brain's like, oh my God, I had shoulder surgery.
I mean, perhaps neural drive just that there's some inhibition from the injury, but it's certainly not neural. It's
down regulation temporarily.
It's quite biomechanical. It's just,
I think another thing, because you mentioned that the majority of them are stiff and painful, that mean, they're going to be painful after surgery, but the majority of them, I think you got to start with, there's so many different variables. Is it one surgeon that they're coming from? Is it multiple surgeons? Are they all stiff and painful? Is it a certain surgeon where they're stiff and painful? How about their pain control?
What type
their
of cuff
pain
tear?
meds? Size of the cuff tear?
Was it mini open?
Tissue,
still doing mini open?
So I think there's so many variables besides, and maybe even assessing your treatment plan for them. Are you being too aggressive with them? I don't know. So I think there's other things to think about.
Yeah, if
I've seen a ton of rotated cuff repairs. Certain surgeons' rotated cuff repairs do so much better than others. So is it their surgical technique, their ability to, get into the
Collateral
tissue,
damage.
get in, get out? So yeah, exactly, collateral damage. So not to blame the surgeons, but there is that variable you have to think about as well.
And if you're observing like a shrug, a hike there with the scapula, I mean, just perhaps we're doing too much too soon. I mean, you shouldn't work through a shrug sign. So perhaps we're just increasing the pain and inflammation and then subsequent inhibition because we're trying to work through a little bit.
Right.
Awesome.
Sweet. Okay, next question is Amy from Johnson City, Tennessee. Hey guys.
Wait, Johnson City, Tennessee?
Yep.
Casey?
Amy?
No, Kate. Isn't that where Casey
that was Casey was from.
Our good friend Casey Carter.
Yeah.
What's Casey doing now?
Not what we thought he was
Right,
doing.
yeah.
I don't know.
Former physical therapist with the Tennessee Titans, our good friend. I'm pretty sure he's from Johnson City, right? I don't know why I get that stuck in my head.
Yeah.
So anyway, what's up, Case?
Hey guys, I thought it'd be hey y'all, but hey guys, what's your take on the use of prophylactic ankle taping bracing in athletes? Do you think it makes the ankles weaker? Does it cause other problems further up the chain?
All right, so prophylactic ankle bracing / taping.
So never had an injury.
Stabilizing. So
apparently not.
Well, no. See, I think that's the thing. Or you had an injury. So there's a bunch of different avenues we can go down with this one here. So one, if you have chronic ankle instability, because once you sprain your ankle a bunch, you just keep spraining it because you tear the ligament or you have too much laxity. It tends to be a problem. So prophylactically stabilizing that, I recommend that to people all the time because I don't want you to sprain it again. Is it going to make you weaker? I mean, no. I mean, I wouldn't train like that. I would just play the game like that because I don't want them to come out with an injury. I would not use it otherwise. I would train out of that to make sure you're not getting weak from that. I think that's like an old. I don't know. Has that been scientifically proven?
I was just going to say that. I feel like that's
knee braces too, right?
Yeah, I think that's like an old assumption.
Knee braces. I don't know. I would be interested to do a little lit search and see. Somebody must have looked. Somebody in the strength and conditioning world, journal of strength and conditioning research, must have. I would hope looked at this to see seasonal changes or whatever.
Right.
In taping versus not taping. Yeah. But I haven't seen anything off the top of my head.
Yeah, I would say I think there's a place. I'm not afraid of the risk, I guess. And I do. I mean, I actually taped like the rear leg on a lot of baseball pitchers in my past, like as part of their routine. Part of me actually always wondered if it somehow helped them, if it helped them with their rear leg drive by giving them a more stable ankle. Remember, baseball players are usually really lax. They played hoops in high school, so they sprained their ankle a million times. That type of thing. But I mean, I would definitely, I wouldn't be afraid to do it. Let me put it that way.
Yeah.
Nice.
Okay. Final question is Nathan from Seattle. There seems to be a disagreement in the literature regarding the relative importance of actual muscle lengthening versus neuromodulation in flexibility gains.
Agree.
At Dave, gymnastics performance requires the acquisition incredible range of motion. What are your thoughts on this issue and the general process a gymnast would use to achieve this?
All right, let's separate this. The first part, muscle lengthening versus neuromodulation of tone or something like that. I think both exist. I wouldn't say that lack of flexibility doesn't exist.
Right.
And there's actually been studies that show just like static stretching and stuff have helped increase your flexibility. Was that neuromodulation of tone, lengthening fibers? I mean, I don't know. I mean, I think there's two different people. Me personally, I know I have a ton of tone. Dave was working on me yesterday. I have a ton of tone, and I know neuromodulation of tone helps me. But there's no doubt in my mind I have underlying flexibility issues under that too, right? I mean, you stretch me. I mean, my hamstrings are brutal, So I don't know. I think both are out there. I think you have to try to define that in the person in front of you. Is this a flexibility or a neural thing?
Yeah. So I've obviously studied a lot of this stuff because of the population I work in, and people's misconceptions, I think, about what the research suggests sometimes leads them down the wrong path. So if you look at like Chris Beardley's research, like Dr. Bill Sands has a lot of really great reviews of this stuff, just looking about like what's happening theoretically. And I guess they're moving away from the concept that like an acute bout of stretching makes lasting changes in your sarcomere length, right? That's been a big kind of old school method as people thought that. But a lot of the things are moving towards maybe we're getting some water content shifting, some blood flow changing, but more so like the perception of a stretch longer term is what maybe getting your, decreasing your nociceptive, oh my God, this feels like my legs are gonna rip off, like you're getting more tolerance to the stretch is the best thing. So it's both though, like you said, it's like there are definitely like tissue changes, but there are definitely neuromodulatory things. So it's not like exclusive, and that's the biggest thing.
Right.
Is like, again, you can't just say it's all one thing.
Right.
And then acquisition wise is a different, kind of ball of wax, because there's a lot of different ways that you can or cannot get in a position. Bone, tendon, anatomical constraints, capsular versus soft tissue. And so the way that gymnastics approaches it, I'll tell you from treating a lot of them, is not 100% on the mark. You know what I mean? What we're doing is not always like they just get flexible. Like a lot of girls get instability over time because we're stretching the wrong things. Or
I mean, I hate to say it, but like gymnastics requires an excessive amount of mobility.
It does.
You have to probably have some underlying laxity to be able to do
Absolutely.
it, or you're not gonna be a gymnast.
they would have never gotten.
I'm sorry.
They would have
You
never
know?
gotten picked to go to a team class if they didn't
Yeah.
have underlying laxity.
Yeah, I mean, if a baseball player doesn't get the right layback, I mean, they're not a baseball player. I mean, it's just, certain people are certain things. I'm not a basketball player, for example, right? I wasn't gifted with that, right? So, I picked up on that in 6th grade CYO basketball. I realized this wasn't for me, but,
You were good in backyard hoops, though.
my net was this high.
6 foot net.
Barely. We gotta go look at that. That's my backyard growing up with Len. But I would say, with just me again personally, I think I have a ton of neural tone, but I'm not threatened by it in any way. And I really don't care about it, and I've been working on it, and it's not working. So it's not just neural drive for me. It's definitely underlying mobility issues with me.
There's connective tissue changes in people. Some people have more or less, and it shows up in muscle fibers.
Yeah. Awesome.
That's all I got.
Oh, that's 3.
So,
Gee,
that's 3.
time flies when we're having a blast with you guys.
Blast.
So awesome. Well, thank you guys so much. Another great episode. Go to MikeReinold.com, click on the podcast link, ask us questions, leave us a review, subscribe to the newsletter, anything you guys want. We appreciate everything from you guys, and we'll see you on the next episode. Take care.